Today topic is nursing diagnosis. Nursing diagnosis generally we will see in the medical and surgical nursing. All the condition fever is the mostly common condition for the medical and surgical causes. So we will see the fever mostly in the nursing, in the medical surgical nursing. We will see this fever condition for any reason, either maybe medical cause or maybe the surgical cause. So here we will see the different types of nursing diagnosis for the fever. Here first one is the disturbed or ineffective thermoregulation related to inflammation or infection process, or psychological disturbances as evidenced by increased body temperature over 1 or 2 degrees Fahrenheit. So here the body temperature is more than 1 or 2 degrees Celsius because of thermoregulation is imbalanced or disturbed. This is the one of the most important diagnosis for the fever. And second one is fluid volume deficit related to high temperature. In the fever condition, we will see the fluid volume deficit. So here fluid volume deficit related to high temperature and a loss of fluid from the body as evidenced by dehydration or decreased urinary output. Mostly the causes of fever is any maybe medical cause or surgical cause. In that we will see the dehydration and decreased urinary output. And next, a third diagnosis for the fever is imbalanced nutrition less than body requirement related to loss of appetite as evidenced by loss of body weight. This is the general condition we can write for the fever or any other cases. Because of imbalance in the taking of nutritious diet, we will see the loss of weight. So this is mainly we can see we can write this diagnosis for any other conditions also, but fever also we can write this. Activity intolerance. Here next fourth one is the fourth nursing diagnosis is activity intolerance related to excessive fatigue or weakness as evidenced by dependence client activity. So here the patient with fever, the patient will experience that fatigue and weakness. So they can't do their activities regularly. So the client was depending upon the others. So this is the one of the diagnosis for the fever. And next one, disturbed sleeping pattern related to body pains as evidenced by insomnia and drowsiness. So the patient is feeling with fever, they can't able to take the rest properly. So they feel that insomnia and drowsiness. So this is the fifth diagnosis for the nursing diagnosis for the fever. Anxiety related to disease condition. So any fever they may get or any other conditions like medical surgical condition, if they got means they will get anxiety. So that is the sixth nursing diagnosis for the fever. Next one, seventh one, knowledge deficit. Generally the knowledge deficit related to the disease condition or knowledge deficit related to the prognosis of the disease, like that. And next eighth one is acute pain related to the inflammation process as evidenced by dull facial expressions. So here we may already discuss that medical and surgical condition we will see the fever. So the pain will be there. The pain is because of inflammatory process. In surgical condition we will see this inflammation. So that the patient will be experience that pain we will see on the facial expressions. So here this is the one of the nursing diagnosis for the fever. And last one, ninth one is impaired physical mobility related to weakness. The patient can't able to do their physical activities regularly. So here we can see that impaired physical mobility related to the weakness. This is the ninth one diagnosis, ninth nursing diagnosis for the fever. So these all are the very important nursing diagnosis for the fever where we can easily remember and we can write easily. We can formulate this, and mostly in this we can select that mostly first one we can select for the fever and any other condition, and imbalanced nursing nutrition we can select activity intolerance and fluid volume deficit. These main four nursing diagnoses are more important where we can write for other disease conditions also.